Hello, I'm John Urbans, President and CEO of Greater Fort Wayne, Inc. Thank you for joining us today for the Roadmap to a Healthy Reopening webinar series. The next hour we will be focusing on the personal services and real estate industry. I'd like to thank our partners in this endeavor, Parkview Health, the Northeast Indiana Regional Partnership, the Allen County Department of Health. Special thanks to Dr. Deborah McMahon and Mindy Waldron at the Department of Health for their great leadership through this pandemic. Also Heather Schegler at Parkview, the staff here at GFW, and at the Regional Partnership. A great deal of time and effort has gone into bringing you this series, and we're proud to be bringing critical information to our business community. Just a quick housekeeping items. We will be using the Q&A tab at the bottom of your screen. The second half of this webinar will be devoted to questions and answers. Immediately following this webinar, you will receive an email with a survey that you can fill out and let us know how you felt the webinar went. You will receive a second email that will have a recording of this webinar, as well as the slides that were presented today. I want to thank all the participants for submitting questions in advance. They served as a guide for the Parkview team to develop the content. While you may not hear your specific question asked, hopefully you will hear information that helps guide your reopening and addresses your pressing concerns. I'd like to introduce the Parkview participants. We have JoLynn Succo, Chief Innovation Officer, Dr. Jeffrey Board, Chief Safety and Quality Officer, Dina Jackway, Chief Community and Human Resources Officer, and Dr. Mike Knipp, Total Health Chief Medical Officer. JoLynn, I'll turn it over to you.
Great. Thanks, John. So thank you all for joining us today. As John said, I'm JoLynn Succo, and I have the privilege of serving as the Chief Innovation Officer for Parkview Health. I want to say thank you for all you have done for us as we've cared for you. Thank you for staying home to stop the spread of COVID-19. We've really been overwhelmed by the generosity of our community, whether it be in the thousands of meal donations we've received, the flyover of the 122nd Fighter Wing, and the socially distanced prayer vigils held by the community in support of our team's response to this pandemic. We're really humbled by your generosity. I also want to share a little bit about how we're doing. So as you can see on this slide, our COVID impact meter, we are cautious, but we are not in crisis. And for the last 60 days, since we've opened our incident command, we have not been in crisis. We've been able to handle the surge, and we're prepared to take care of the needs of our region into the future. Where we are today, the number of patients with COVID positive who are in our inpatient units has plateaued. We're planning to restart some elective surgeries gradually on Monday, and we're really starting to see people come back to our emergency rooms, and this is really important because we're seeing patients who've delayed really important care. So we're very, very hopeful. We, like you, are beginning to think about how we begin to safely open up the parts of our operations that we've suspended due to COVID-19. We're also thinking a lot about how does the world look different today than it did 60 days ago? And there are some really important considerations that will continue to guide our actions. First, COVID-19 is here with us in the community. We will continue to have positive cases. We know that a vaccine is at least 12 to 18 months away, and we don't have any herd immunity. We think it's going to be a little bumpy as we reopen, and we expect some surges. We want to keep those surges as low as possible. We're also really operating in a world where the information that we receive is evolving and dynamic. We're implementing safe practices that will help our coworkers, customers, and community. And we know that crises like COVID challenge us to think differently, innovate, and emerge stronger. So we spent a lot of time across our operations thinking about how to open in the safest way possible. As the community, you've been so generous with us. We'd like to return that generosity to you by sharing what we are learning and doing. You're going to learn more about our free service offerings later in the webinar, but one thing that we've created is a website to share what we have learned and what others are doing in a variety of areas. This is going to be a living document that will evolve as our dynamic situation evolves. We have it full of workplace considerations and people considerations. We've also established a hotline, and we're promising a one-day turnaround for subject matter experts on questions that you may have. We want to stay in dialogue with you as this situation evolves so that we can all open safely together. With that, I'm going to turn it over to Dr. Board, who's going to talk about workplace considerations.
So let's think about the workplace for real estate and other services. The interesting thing about these types of industries is that you may have an office location such as a real estate office, but that often business is conducted in people's homes or in other offsite locations. So when we think about place, we think about an office area, think about the physical building, the physical space, what are common areas? So if you have a real estate office, for example, do you share that building with other businesses? And do you have common areas such as lobbies, elevators, etc.? Do you meet clients in other public or outdoor spaces? Where are you engaging with your customers and clients in your place of business? We have to keep in mind the community status of COVID-19. So in the United States, COVID-19 has what we call community spread. It's not limited to any one place or area. And if someone comes into one of our clinics or hospitals that has COVID-19, we are generally not going to be able to pinpoint where they acquired the infection. Because COVID-19 is a novel coronavirus, it means that anyone in the population is susceptible to contract the illness because there is no prior immunity. Even though everyone has an equal chance of potentially contracting the illness, there are some members of our community that are more at risk for severe illness from COVID-19 than others, particularly older adults, those 60 years of age and older, and those with other certain health conditions may be at risk to have more severe illness if they contract COVID-19. It's important to keep these things in mind as we develop our safety plan to keep both our employees and our customers and clients safe. A very important framework in occupational health and safety is what is called the hierarchy of controls. This is a framework that allows you to stratify from most to least effective the different types of interventions that you can put into place to maintain safety and mitigate risks of hazards in the workplace, either exposure hazards to your employees or to visitors, clients, and customers. The top of the list is elimination. That's physically removing the hazard from the environment. Second is engineering controls, which is isolating people from the hazard. Third is administrative controls, which is changing the way you do work in business and how you interact with others. So this is things like behaviors and workflows that can help mitigate risk of exposure. Finally, at the bottom is the last line of defense, which is personal protective equipment. And we have to keep in mind that we have to select the right kind of personal protective equipment for what the employee is doing and the type of task and what type of hazard that they may have, and that they have to have proper training on selection and use of that personal protective equipment. In particular, how to don or put on, and also how to properly remove personal protective equipment. The CDC recommends that all businesses consider following controls, things like your building's ventilation system, thinking about administrative controls, so making sure that employees, visitors, and clients know how to practice proper respiratory etiquette and hand hygiene, that you have access to things like hand sanitizer and other things to help support appropriate social distancing, as well as routine and enhanced cleaning and disinfection practices. So this may be occurring in workspaces throughout the business day, or if you're going on site, say to a home in a real estate situation, making sure that you have measures to mitigate risk of passing virus from exposure to high contact or common contact surfaces. So when we think about a business environment such as office space, I want to call your attention to the diagram on the right. So this is from Toyota Safe at Work, and this was a redesign of a workspace to eliminate some cubicles or workstations in order to provide appropriate spacing between individual employees in a workspace. I want to spend a few moments talking about testing. There's been a lot of attention regarding testing in the media, and it's important to understand the two main types of testing that we use clinically. First, I want to talk about antibody testing. This is a blood test either done by a blood draw or a finger prick with a blood droplet. This test does have important use as a population surveillance method to evaluate past infection in a large population or in a given community or geographic area. Antibody blood testing is currently being used by the Indiana State Department of Health to do population surveillance studies in each county within the state of Indiana. This can help inform things such as public health measures and policy decisions in order to guide public officials' decisions about things like reopening and other public health measures. It also plays a role in specific types of clinical research on COVID-19. It is important to keep in mind that there are some very important limitations with antibody testing. At this point, medical science does not know whether COVID-19 antibodies are protective, meaning that if you have a positive antibody test, we do not yet know for certain whether that means that you are protected from reinfection with COVID-19. It also is not yet known whether if someone has an antibody titer, whether or not they could or could not pass the virus on to others. In order to rapidly get as many tests available to market quickly, the Food and Drug Administration waived many of the standard requirements for diagnostic test evaluation. This means that many of the tests on the market have not undergone any formal scrutiny or evaluation by the Food and Drug Administration and have not undergone evaluation, what is called validation testing, by a clinical reference laboratory. As a result, many tests that are currently offered on the market may be inaccurate or unreliable, and this is something that's important to keep in mind. It is totally inappropriate to use antibody testing for return to work decisions on an individual basis. The next type of testing is what is called PCR. This is the nasal or nasopharyngeal swab. This is used to diagnose active infection in people with symptoms. So if a patient comes to a Parkview clinic, emergency department, or hospital, we use this type of test to diagnose COVID-19. An important limitation is that people that are asymptomatic may not be shedding virus in the posterior pharynx or the back of the throat. As a result, the swab may not be able to detect the virus reliably in asymptomatic individuals. So this test does have limited utility and is really mainly for diagnosing the disease only in people that have signs and symptoms of COVID-19. It's also important to recognize that this test only provides a snapshot in time. So we can only detect virus at the time that the nasal swab is collected. So a person can be tested on a Monday and have a negative result, subsequently be exposed, and then develop symptoms or be able to pass the virus on to others, even though they've had a negative swab at an earlier point in time. When we use the hierarchy of controls framework at Parkview Health, we call this more than a mask. And we use all of the hierarchy of controls to identify opportunities to minimize or eliminate risk of infection. So for the elimination part of the hierarchy of controls process, some examples are telling employees to stay home if they are sick. If an employee does not come to work sick, they cannot pass that illness on to others. Another way that we have used the elimination strategy to help keep people safe is employing what we call virtual health. Last week alone, Parkview Health providers completed over 6,000 virtual health visits We use telephone or video to provide patient care to people in the community. And by doing it virtually, we eliminate the risk of infection to patients or coworkers. We also use engineering controls widely in our place of business, particularly in our clinical operation, but also in non-clinical areas where appropriate. Third is administrative controls. These are things such as training on cough etiquette, social distancing, regular attention to hand hygiene, and regular cleaning of high-touch services, as also eliminating common high-touch items. Finally, there's PPE, and I want to again emphasize selecting the right PPE and making sure people are trained on using and selecting PPE appropriately. Now I'd like to turn things over to Dina Jackway, Chief Community and Human Resources Officer.
Thanks, Dr. Board. So it's great to be here with you all today. We recognize that the last 50 to 60 days have felt like, as one of our local CEOs put it, like you're flying a plane and trying to fix it at the same time. A lot has changed. Our world has changed, our community, and certainly individual workplaces have changed as well. So when we think about people, and today as we dive into the people section, thinking about the most valuable resource we have in an organization are our people. And that could be, yes, those coworkers that are working there, but also your customers and who you're interacting with, any vendors or the community at large. So as we begin to look at how that shapes the workplace, as we look at recovery and restarting businesses, it's going to be really important to consider that broader group of individuals. So the CDC has put out some really good guidance, and we just want to share a few of those here today. The first of which is identifying a workplace coordinator. Now, I know that not all of you have HR departments or large organizations where you have someone that is going to be like an incident command like we have here at Parkview. But we do really recommend that you find someone that can be that single source of truth, because your coworkers are going to be asking a lot of questions. There are fears. How is it going to be when I come back to work? Or how do I help protect myself and protect my family? So having someone that can be that workplace coordinator to filter through all the information and ever-changing guidelines that are out there, because you want to make sure that you're providing them, again, with the most accurate information. When you're educating your coworkers, I think it's also important to make sure that they understand the why. When you're talking about new ways that they're doing things, or their work might look different, or they may have new additional duties that they need to do, well, explaining the why behind that is also going to help lower the fears and lower the concerns about entering into a home or entering into an environment or doing something different than they've ever done before. Implementing flexibility, and I think that that is really important. We all as an organization have had to be flexible over the last 50 to 60 days, and more flexibility than we ever thought that we would have possible. I mean, as a quick example, Parkview has always not had a lot of individuals that worked from home, and as this began to hit, we ended up sending 4,500 of our coworkers, of our 13,000, working from home. And as Dr. Board mentioned, the virtual visits, all of these things that we've begun to engineer and really do very differently, it's because we've had to be very flexible. When you're considering social distancing, which we all need to be doing, I just want to make a special point to also consider you're vulnerable. And that could be one of your coworkers who perhaps may have another medical condition that makes them more susceptible, and they are vulnerable. And so they may need to ask for accommodations. And so that's something you want to be ready for as an organization and be able to respond to that, have a process. But as well on not just those coworkers, but as well on the customer side. You may have customers who need to access your services a little differently because they are in a vulnerable population when it comes to COVID. So keep those in mind. And then we all have new practices that we've started that what are we going to keep in the new normal? There are some really great, in every industry, as we've done these webinars, there's some great new best practices that each industry has come up with. We might continue those into the future, and we would encourage businesses to think about what makes sense to continue. Next, I just want to hit on the return to work process and Not so much specifically about Parkview's process, but we really want to encourage, because this is a good lesson for us, because as a business, we've had to come up with a process for our sick coworkers coming back to work. And just as you in your business, you want to keep your coworkers safe. You want to keep families safe. You want to keep everyone they come into contact with safe. And because of that, having a process to determine when someone can come back to work after they or a direct family member in their household that they've come into contact with has been ill. So keeping that in mind, it's going to be really important, especially as you begin to reopen and recover. So just a few comments I'll make about what Parkview is doing. And there's a whole lot more behind this, and we're certainly happy to go into more detail with you later. But we've had a few things that we've learned that have been very successful. And first seems very simple, but we asked our coworkers, what do you need? What are your barriers? What are the things that is on your mind, and how can we best help you? And by asking them that question, we were able to get so much information about what their fears were so that we could in turn respond more appropriately to them. That gave us so much information. The voice of your coworker and your customers are so important in this so that you can quickly adapt and be nimble. We flexed benefits, and that could be our leave of absence benefits. We expanded our PTO so people could go into the negative when taking time off. We just came up with all kinds of different ways to access benefits differently than before. And then finally, really acknowledging that everyone is an individual and experiencing this differently, and their own personal situations are different. So caring for their mental health, and what are we doing? And we've done several things internally here at Parkview, and there's lots of ideas and resources out there, but really helping individuals address their personal needs. One quick example of something we did that was very helpful was the Calm app. So it's an app on Google Play and Apple, and it's simply this ability to have breathing techniques at your fingertips, or ways to engage into deeper sleep, being able to have sounds, reducing anxiety. And that was simple, and that's really been something that's worked for not only our coworkers, but bringing them home to their families. So keeping people at the heart of everything that you're doing. I'm now going to turn it over to Dr. Nip.
Thank you, Dina. Hi, everybody. Dr. Mike Nip here with a couple just more specific insights to your industry. So looking at some things regarding the real estate industry, I wanted to focus on a couple things. First, here on the orange box on the left side of your screen, a couple points to call out. First of all, whenever you find your solution, be it at the elimination or down to the PPE, we want to make for your patrons and your employees the optimal and safe and healthy choice as easy and automatic as possible. So you're seeing some of those things like there at the cleaning of the high touch surfaces. I wanted to jump over to the other side. We've also been collecting a lot of great ideas from the real estate community. We have a couple more, but just for example, in elimination, it seems like it's shifted to virtual showings, and then the second showing may be the more traditional in person. The second point there is in engaging your people and being part of the solution. Your next great innovator, it may be their first day on the job, and they've untied that Gordian knot for you. The third thing is to be very communicative about what you're doing to optimize the health and safety of not only your employees, but also your patrons. This might be updating your website to say, here's some extra steps we're taking. You all are experts on creating the experience for your customers and your employees, but the extra information and the time shown can go quite a long way. Here's a couple other ones. We see our picture of someone with this cleaning wipe that's going for the high touch door handle. So some administrative things there, and some things that are already happening, which are very good in line with the hierarchy, or for example, as you're seeing, requiring masks. The realtor is wearing gloves and is giving hand sanitizer to the client. Restricting a little bit of some high touch areas. I guess it's back to, grade school. We're touching with our eyes, not with our hands, so to speak. And then they're limiting how many people are going to be in a home at a time. So this really dials into adjusting open houses and how that strategy continues. Closings, as you see, are shifting here to being remote meetings. And also, a lot of times you're just going to be in your vehicle, and paperwork, that transfer will happen there. I did want to briefly touch on a couple things. I think we may have a couple folks from the service industry. And reaching out to our plumbers, electricians, HVAC folks. A lot of the same things will apply, because you're really going into an environment that you can't control, but the idea is to control as much as you can. So you may shift, if you're not already, to calling ahead saying, hey, I'm Mike from the plumber, and I'm going to be coming, just to let you know when I get there. I'm going to be in a mask, just to preface what their experience is going to be. And you may need to shift to being very obvious about putting on gloves at the door. I'm used to, they're putting on their shoe coverings, but doing that and adding that extra layer for the comfort, and just being very open and trying to front load what the customer is going to expect as you're going into their home. The next slide here. So when you land on our site, Jolene's going to come back in a second and talk about this. You're going to find your industry specific section. And what we've done is tried for you all to find kind of the best of the best with resources that are already out there. So you can, no matter where you are in your journey to reopening, to try and start the process, continue, or just tie up a couple things to get you up and running again. Having said that, I'm going to turn it back over to Jolene here.
So at Parkview, we are here to help. As we are so touched by the generosity that we've received by the community, that we want to return some of that generosity to you. So as we continue to operate in this pandemic, we would like to help leaders to lead. So while you might think of us as your provider of choice for healthcare, we are also the largest employer in the region. We operate 10 cafes, a police force, have an extensive grounds crew, office areas, and frontline areas. So we are learning every day in all of these settings. The dynamics of this pandemic are changing rapidly, which means that our responses might change as well. We are going to be offering coaching to help for a safe, phased approach to reopen your business on a variety of topics and the things that we're learning. We have also launched a website where you can access helpful resources, best practices, things that we're doing, as well as links to others in the industry. This is all free to you. You can call us at 260-CONNECT, email us at parkview.com/businessconnect, and there's also a link on the webpage. This will be up, and we will get back to you within 1 business day. We have a number of subject matter experts who are standing by to answer your questions. We're going to continue to evolve the website and the services that we offer as the pandemic evolves, so keep checking back for more. With that, I'm going to turn it back to John.
Jolene, thank you to you and the whole team there at Parkview on the presentation. I'm just going to remind everybody that the Q&A tab at the bottom of your screen is open. So please feel free to submit questions down there. We have some that we'll go through, and then we'll get to the questions that pop up in the tab as well. The first thing we're going to talk about, obviously masks. There's a lot of conversation about masks out there. Should I require all my employees to wear a mask to work, and if so, what kind?
This is a good question. So I want to again emphasize the importance of thinking about that hierarchy of control framework. So the hierarchy of control says make sure that you first consider elimination, isolation and administrative controls before you go straight to personal protective equipment. That being said, if there are situations in your workplace or with your business process where you can't eliminate, you can't isolate people from the hazard, you can't use an administrative control, then masking for things like source control can be a consideration. The CDC has recommended masking in public areas where you cannot socially distance, and the purpose of a cloth mask or face covering is source control, meaning that it is blocking my cough and sneeze when I'm putting on that cloth mask from everybody else. That's different from, say, wearing a respirator to protect me from either, let's say I'm a nurse, providing direct patient care to someone who may have COVID-19. I'm going to be wearing personal protective equipment to protect me. Or if I'm wearing a respirator and I'm working with a chemical or something that generates fumes, that's to protect me, the wearer. So it's important to differentiate that. Look at your state, local, and industry regulations. So if you are, if you run a cleaning service and you're working with a chemical that generates fumes, have the proper type of PPE or respirator for that task. Those guidelines still apply. If you're going to do masking for source control in your place of business, some things to think about. Does your place of business have uniforms? If they do, then think about if you're going to do masking for source control for your employees, would you want to provide those masks so that they are going to be sort of part of the uniform, and make sure that you have people, that your employees have clarity on training. When should I be wearing the mask? How do I put it on and take it off and wear it properly? How and when should the mask be laundered, etc.
One of the big questions right now is about access to personal protective equipment. Where can I find masks, hand sanitizer? If you go to the GFW Inc. website and go to our COVID response page, we are keeping a list of companies locally that are producing masks, as well as some national resources. We are kind of staying in contact with the state of Indiana and their response. As we wait to hear what the governor has later to say, we will be getting out more information on that. So please keep tuned into our website, and as we hear more, we will get that out to individuals throughout the weekend. One of the key questions is, how can we meet with customers or clients in face-to-face meetings, small spaces, other one-on-one situations?
So first of all, I want to maybe think about, do you have to have that face-to-face meeting, right? So one of the things that's really been an innovation that we've certainly done in the healthcare setting is we've done a lot more of these interactions virtually. And so is there an opportunity to reduce the number of face-to-face meetings with customers, clients, or vendors by using a virtual solution? That's using that hierarchy of controls. You're eliminating the risk by going virtual. When you cannot go virtual, having a scheduled appointment, and then maybe using a conference room instead of a small office so that you can have that 6 feet of separation. The other thing to think about is, are there written materials or other things that you might want your client or patient to look at? Well, either have those materials already in advance or share them digitally, project them on a screen, as opposed to handling paper or brochures that maybe you would pass back and forth. So just thinking about doing the work a little bit differently. If there really is not, none of those strategies are going to be effective, you can consider, for source control, using a cloth mask or face covering for both the employee and the client to help provide some additional measure of safety. Making hand sanitizer available, cleaning high-touch surfaces is also very important.
I want to remind everybody that the Q&A tab down at the bottom is open. So if you have questions, please go ahead and submit those, and we'll get to those after the next couple questions. One of the issues that a lot of us have is we have a waiting room where visitors sit before appointments. How can we encourage visitors to socially distance and any other safety measures there?
Hi, it's Dr. Nip again. So I think it's many of you on the call industries have realized this is a pause point, and then it's a renovation, fresh eyes look at what you do, and not including just your space, but also your process. To the first point there is, looking at your waiting room and trying to think, can we engineer in the social distancing, again, making that healthy, optimal choice very automatic for our folks by spacing chairs, putting on, the ground marking, where should you stand, those sorts of things, making the hand sanitizer, making it easy to do that hand sanitization. And also the thing too with, some of those magazines, I'm sure in some of our waiting rooms were current in about 1985 or something like that, but even if they're more current, that's a high touch item that is going to be hard to keep clean. So maybe removing those. What do we do with our brochures? Obviously, you want your brand out there. You want your customers to have information. A lot of places have moved towards, hey, here's a picture of the brochures we have. Can you ask us for one? We'll give you one of those. That's your copy. So you're not having to keep that out in the waiting room. And then again, to echo Dr. Lord, that, minimizing the amount of people that are actually there. It is whoever is just there for the appointment. That's really going to be the person that is going to attend, and they don't have other folks with them. Those are just a couple of ideas.
What if I've had somebody out on vacation? Should I consider asking them to quarantine? Does it matter where they've visited?
So that's a common question we're helping folks out with. It's kind of a two-part thing, as if traveling gets a little more to be a thing based on orders, people are going to travel, so it's going to be a reality. The split I'm seeing is, if international, we still have to abide by the CDC and the State Department. Internationally still is a level 4 advisory. Nationally or domestic, it's a little bit of a case by case. We've had some employers reach out regarding some folks that have been to New York City, which for several weeks has been the epicenter, or been called the epicenter. So it's kind of a case by case. The decision's a little bit more clear cut if they've been outside of the country. And again, the common thing is, though, to revert back to a rule 0, if you will, of please asking the ill folks not to come into work, self-monitor for symptoms. If they will be present in the workspace, what sort of controls can they do? Self-masking, hand sanitizer, gloves, and those sorts of things.
There's been a lot of comments out there about taking temperatures. Should we be taking temperatures before we meet with somebody, or before we bring somebody into a house, or if we go into a house?
That's a great question, John. So on the surface, temperature monitoring may seem like a very easy and simple strategy, but there's a lot of considerations that go into that may not be apparent. So the first thing is clinical. So one of the things we know from medical literature and from our experience of evaluating and treating patients with COVID-19 is that many patients will be diagnosed with COVID-19 and may not have a fever when they first present with illness and early symptoms. So a fever is not a reliable indicator of someone who might be infectious. Certainly if they have a fever, it's concerning, but if someone has a cough, some shortness of breath, and muscle aches, but without a fever, they could still be infectious. They still could have COVID-19. So that's very important to understand. The other thing is, how are you going to collect that temperature? So in order to collect the temperature, unless you're using a remote infrared camera, which is very costly and difficult to implement, it's going to be something where you're going to have to be within 6 feet of that individual, which means you would have to don appropriate personal protective equipment. Using a contactless method like an IR thermal handheld thermal scanner, the ones that they're not easy to get when most of the ones that are available on the market are going to have an error of plus or minus 2 degrees Fahrenheit, which means that it can easily give you a falsely normal temperature in somebody with a low-grade fever. And also, if you're talking about monitoring employees, doing a temperature assessment to make a decision about whether that employee can either come into work or stay at work, that's actually protected health information. It has to be handled like protected health information. There has to be a formal policy, and everybody from the president, CEO, or owner of the business all the way down to the first person on the first day on the job person has to be treated equally. So doing temperature monitoring has some very important caveats and limitations. So think about also, think about that symptom-based. Think about keeping people home if they are sick.
I just wanted to, well said, Dr. Board. Dr. Napier, I just want to add one other thing. It's a sticky enough wicket in an employer-employee interaction, let alone if it's let's say you're having you're the realtor and you're showing a house to someone who is not your client, to try and it's their personal information anyway. There's not even an employer-employee arrangement there. I just think it would be really difficult to require any sort of requirement beyond things that kind of fall under the common sense. That can you try not to touch things, hand sanitizer, those sorts of things, because it could be seen as an invasive step to say, Dr. Board is here, I'm going to show him this property, and I'm not going to let him in unless he lets me take his temperature.
Can you touch on what if I have somebody that I work with that does test positive? What should I do?
Sure. Well, to borrow from the Hitchhiker's Guide to the Galaxy, don't panic. That would be the first step. As we do know, there's been a lot said about testing and how it is not meeting really what we'd want it to do. That person, the current guideline CDC, if someone does test positive, of course, we want to support them with a official policy that applies across the board to can they remain at work, should they come to work. That should look back to your company illness policy, giving them guidance interim on where to go for care. The CDC, again, it's looking at about 10 days from the date that positive test was collected for a return to work. The other thing I wanted to do mention that qualifies that is we're kind of calling the 772 rule, to say that the 10 days back assumes they remained asymptomatic throughout. If, for example, I test positive today on the 1st, I would maybe have a target return at the 11th if my math is okay. But let's say in a few days I get a cough or a fever, we would kind of reset the clock, so to speak, as 7 days from the onset of my symptoms, and I need to be looking at 72 hours fever-free without using a medicine to reduce my fever. Or does my cough have to be gone? Well, it should be improved. If I'm going to come back, we want to make sure that I'm going to go ahead and mask myself, with the focus being cough as a functional spread mechanism. And I guess I'll touch on for a second do we need a return to work note? Again, I would have employers seek their legal counsel to understand what their policy is and just make sure they have something that applies to everyone. We have been helping employers with that conundrum because in the past couple of weeks, it's been a little bit more difficult for some folks to access care, to get a visit, virtual or not, to get a return to work note. But as long as we're kind of working on the honor system, looking at the 772 rule, I think many, many people have been able to return to work and get back at it.
One of the terms that we've heard come up recently is the whole concept of tracing. As people are probably in this industry going in and out of different homes, meeting with different people, should they really consider keeping some fairly detailed records on who they're meeting with and when, so that if an issue does pop up?
It's a very good question. So there is the Indiana State Department of Health recently did announce a plan where they're going to be partnering with an agency to expand and utilize contact tracing as part of the statewide strategy. Certainly keeping a log of your business interactions, particularly with members of the general public, like if you are a service person that goes out to homes, or you're a realtor or something like that, I think it's a reasonable and good idea to maintain a log of who you met with and where you've been, just as a precaution. It's, to my knowledge, not required, but it would be something that would be a helpful reference in the event there was a contact tracing for a particular person that you may have interacted with.
Mindy, is there anything you'd like to add to that?
I have to apologize. I did not hear the question.
Oh, I'm sorry. The question was about tracing, and these folks are going into homes, working with different individuals. Should they be keeping maybe a log of who they're interacting with, so that if an issue does pop up?
It is not a bad idea. A good portion of what we do is jog people's memory when there is a case, and where were you and who were you with, and all that is often hard to recall. So it's not a bad idea in this day and age.
Mindy, is there anything you could add on obviously there's been some press about a testing site opening up here in the county. Could you give just a brief on that?
Sure. We did partner with Kroger and their Little Clinic, and they are bringing free public testing to Allen County or to Fort Wayne area. They started out at Bishop Dwenger yesterday and today. I believe all of their appointments got filled within a couple hours, but they do plan to extend it through the month of May. The way they explain it is it will be somewhere between 2 to 4 days a week, and they will announce those weekly once they get the actual additional test kits in. And as I said, currently at Bishop Dwenger, but it sounds as if they may move around the city once we find sites for them so that they could be in different areas. So people can pay attention to the media. It is all by online portal where you're virtually screened, whether you're eligible, and it's generally what the CDC guidelines are at the time. It's very simple. We can provide the link easily. They then make an appointment at your choice, and then you go to the site, and it's relatively quick as well. So we will keep the media posted as Kroger does. We'll duplicate their press releases so folks know where those are at. And then secondly, we are working on another, at least one public testing site in collaboration with the State Department of Health and another company. So as soon as we're able to release that, we are hopeful in the next couple of weeks that would also be deployed.
Thank you for that. I want to thank all of our presenters today, everybody that answered questions. I want to thank our partners, Parkview Health, the Allen County Department of Health, the Northeast Indiana Regional Partnership, and Greater Fort Wayne Inc. for all of us bringing this series to you. Stay safe, and I hope that you all have a good day. Thank you.